right, guys. So I'm here today with Anbu. She is a past client of mine, and she is also a very good friend of mine. And Anbu, she runs a physiotherapy clinic, and it's called Aristo. Anbu, thank you for being here with me today. I appreciate your time, taking your time out of your busy schedule to be here with me and talk about you and your business. So why don't you tell everybody a little bit about yourself and what you do and how long you've been in business for?
Thank you so much for that, Vinay. And hello, everyone. As you have told me, my name is Anbu and I'm a physiotherapist. My full name is Anbuselvi Jayapaul. And I've been having this clinic, and it's been like past 2.5 years. 2.5 years, Vinay, that I'm having this clinic. Vinay was the one who helped us getting this clinic. And it is a multidisciplinary rehab clinic with services like physio, massage, chiropody, chiropractic and other services. And I've been a physiotherapist for 20 years. That's including my experience back home in India, but I'm here in Canada for 6 years. I'm also specialized into women's health. I mean, most of my clientele are musculoskeletal population, but there are a small amount of population that I deal with women specifically. And that's me.
Right. And from last time, I think you mentioned you were doing something specific to pregnant women. Is that correct?
Yes. So women's health has specialization, not particularly pregnant women.
Okay.
So it's actually called pelvic health. Many of them do not understand what is pelvic health. So pelvic health is both for men and women.
Okay.
So it is with reference to pregnant women's, and also any kind of a population who has problem with bladder problems, bowel issues, and any kind of other pelvic issues. Could it be even a sacroiliac joint pain or even the low back pain, which cannot be handled by a physiotherapist, musculoskeletal physiotherapist in that sense.
Gotcha. Very interesting. So, I mean, everybody's home right now. Everybody's kind of, I'm assuming the clinic is closed, right?
Yeah, it is.
So what changes have you had to make in your business to kind of start adapting to these times?
It's very interesting. It's been just like 2 weeks, and there had been a lot of changes, that I should say.
Yeah.
I mean, with reference to physiotherapy, it's more of like people come to the clinic and we treat them with hands-on exercises, stretches. Now it's all the way around. We do more of things over the virtual rehab or tele rehab, where we get connected to the clients. Most of them right now, what they need is an assurance, saying that we are there for them. They can still continue their care. They can still feel all right. They can still get rid of their pain. So all of my tele rehab and phone call consultations have been just reassurance.
Right.
And that itself solves like more than 50% of what they have. And the rest, specifically according to what they need is what we are doing right now. So most of them are virtual consultations. I don't deal with any kind of an emergency patients in my clinic. Of course, that is something that we are allowed to do if there is anything at all.
Right. Tell me more about the online appointments. How does that work? Like, because I would like a lot of your business is hands-on, right? So
yes,
you're kind of hands-on working with them and helping them. And how have you transitioned that to like online versus your normal kind of practice?
Yeah, it is a bit of challenge when it comes to the therapist to actually get the clients to come for tele-consultations, tele-rehab consultations and all that. Because we all have a mindset of seeing a physiotherapist in person, getting a hands-on therapy. It could be a soft tissue release or some things, and then guiding them with the right exercises and all that. But it has when it comes to physio itself, it has much wider scope than just hands-on.
Yeah.
Like even guiding a client on very simple techniques of this is the right exercise to do, or you can position yourself right. This is the position that you could sit in, the posture that you could sit in when you're working on the computer. All these small little things are things that come into great use when it comes to tele rehab. Example, oh, show me that staircase which is causing you the problem. Oh, show me your computer. Let me see how you're sitting. So that practical thing. And the other thing that I could say is the connection that we have with the client.
Yeah.
That the connection with them and showing them, they practically showing that this is what is the difficulty is what is helping them. The challenge, on the other hand, is that, they don't have the right means. Let's say I'm teaching an exercise with a resistance band. That is something they might not have. So that puts us in a situation to be more creative, to see what they have at their home, to see how that could be helped about and getting them all right. So there's much more to hands-on. So the ultimate thing is getting the client to be dependent on what they are doing, making them self-dependent on their care. That's what we are doing right now.
Yeah, I like what you said about seeing their environment. So like looking at the stairs that they're trying to go up, or how their posture is, right? Because a lot of the times when they come in to see you, you don't get a sense of that. Like they might describe how they do it, but actually you getting a chance to see it and kind of understand what environment they are in could definitely help you in your diagnosis, right?
Yes,
or your
that's
kind
right.
of how you're going to help them, go about helping them. So that was quite interesting about that. Can you share with us maybe some basic things that people can do at home with respect to their rehabilitation? Like example, let's say they had like a lower back issue, right? I'm sure you would recommend certain things that they could do at home to, help them with manage their pain, or kind of just keep that area stretched or manageable until they're able to, whenever they're able to come in, right?
Okay, so before that, Vinay, let me put, you particularly have been telling me that you have shoulder pain, right?
Right.
So what have you been doing about it?
So just stretching, trying to keep it as loose as possible, trying to stretch it out every day, opening up my posture. You've kind of given me some tips along the way. And it's funny because, for me, it was more the time, right, to come in and kind of and deal with it. That's always been my issue. Now we have time, but we can't come and see you. So that becomes the challenge now. But for me, it's yes, I do have it. I think for me, it's related to the way I sleep, to be honest.
Yeah.
Because I am a side sleeper. So I think a lot of it has to do with pressure that I put on that.
Yes, there's your answer, the time. So earlier, you might not have had the time to look into what you have been doing. Right. Now we all have the time.
Yeah.
Right. So time is a factor. And that's what I would say would be the first thing. First thing is take time for yourself, irrespective of whatever schedule you have, whatever activities or whatever your work nature, job nature, school, sports, recreation, take time for yourself. Yeah. Now we have all the time, and even in a busy schedule, taking that 15-20 minutes of your time for yourself would be the first thing. Yeah. The second thing, as everyone says, a sound mind in a sound body. Right. We're all stressed, including myself, highly stressed. So when that stress is being removed, half of your pain goes away.
Right.
So we as physios have all right now, not right now, many of them have already taken what we call it as a biopsychosocial approach. Because when I'm treating Vinay, I'm not treating Vinay's shoulder. I'm treating Vinay as a person.
Right.
So a person's overall well-being is definitely important when it comes to care. Mm-hmm. So take time for yourself, take at least 15-20 minutes off day. Do not stress out, relax as much as possible. And definitely you might do some basic exercises. Again, motion is lotion. Keep moving.
Right.
We physiotherapists help you move, and we are there to guide you on the right track.
Yeah.
Okay. So that the guidance is something that we are giving, that we have always been giving, and we are still here to give it either by telephone or a video call or anything. But most of it should come from you.
Right.
It could be anything for back pain, shoulder pain, or something. Take time for yourself. Keep moving. Don't stress. Reach out to us if there is anything at all specific to anything which is for your shoulder or knee or back.
Right. Like you said, it's up to us to do the work for ourselves, right? I mean, you can give the instruction of you got to do this exercise or this, but we ultimately have to be responsible for ourselves and take the time to better ourselves as well, right?
Yeah.
And now everybody has time. There's no excuses, right? So it's super accurate, and I couldn't agree more. One question I did have actually is, with the online and the telephone consultations that you guys are offering now, a lot of people, I guess, they use their employer's benefits to cover the cost of these things. How are they still able to apply that to your consult?
Yes, they are. Most of the insurance companies are covering the virtual rehab visits.
Right.
Even WSIB, the workplace safety injury clients, and motor vehicle accidents, which we go through the insurance, all of them, everyone are covering virtual rehab. So the ultimate goal is actually to help the clients by whatever means possible. And we can still bill them directly as we have been doing earlier through teleportal and all that. And people who do not have insurance, also it is fine. We are still seeing clients like that. And we also have some no obligation consultations. Someone who's not sure of what is tele rehab, and I'm going to go see a physiotherapist, all that I'm getting relieved is by a hands-on. What are you going to do in tele rehab to make us feel better? We have that free no obligation consultation where you can talk to us, ask us any questions with reference to your health, well-being, or it could be even common questions. So we are there to help in that way as well.
Amazing. So if people want to get a hold of you and your clinic, can you let us know how we can go about doing that?
You can email me. You can call me. I have both my cell phone and my clinic phone number. So these are the main ways. And you can visit our website as well. There is a contact form. You can contact us by any means.
So what's your website?
So that's www.aristoclinic.com. My email ID is main@aristoclinic.com. Do you want me to tell the phone number as well?
Absolutely.
Yeah, the clinic's phone number is 647-351-4813, and it is connected to my cell phone, so I receive all my calls at home.
Awesome. Thank you so much, Anbu. It was amazing talking to you and getting your feedback, and I love how you're still helping people and you're still out there in full force, helping your clients and being there for your tribe, essentially, right? So I really appreciate your time and taking this time to speak with me. And guys, if you need anything, Anbu's always here to help answer any questions and ultimately serve you with your rehab needs. So thanks again, Anbu, and
thank you so much, Vinay.
Stay healthy, stay safe. All right.
You too. Stay safe. Bye.
All right, bye.